welcome to the Daily Dose with Dr. Cristin. I'm Dr. Cristin Fitzpatrick, International Healthcare Professional of the Year and Director of the Mediterranean Brain and Spine Center, home to Malta's award-winning international team of specialists. Here's the Daily Dose. We're focused on what truly matters, helping you and your family stay healthy, balanced, and thriving every day.
Good morning and welcome to the Daily Dose with Dr. Cristin. Today is a very special day because we are interviewing Dr. Cristin herself, director here at the Brain and Spine Center in Nashar, and also Malta's International Healthcare Professional of the Year. So, Dr. Cristin, welcome. And today I'd like to ask you, what is the difference primarily between autism, ADHD and dyslexia? Tell us a little bit more about that.
Okay, those are really good questions to ask. And I feel like part of my mission and my purpose being here is to help open up the discussion, help share some information, and help move forward in a positive way in our community near and far. These are some healthcare neurodevelopment conditions that more families are facing as we go on. Last month, I spoke in America on a global summit focused on brain and spine health for kids. This was directed more at other doctors, pediatricians, physical therapists, occupational therapists. These types of factors, when we get into them, we actually have much more control about what we can do to be proactive about improving brain development. So when I speak of brain development and we say neuroplasticity, it sounds like really cool, exciting scientific words. Now, what we want to do in the practice specifically is sort of explain what that means and then give families and children certain things that they can do on a daily basis to help improve how the brain functions. When we talk about brain development, this starts even before conception. So preconception and planning is an important component to what we're looking at with neurological development. We know that the brain controls everything that the body does. So all the automatic things that we don't think about doing, our heart rate, our breathing, our digestion, our sleep patterns, to more complex activities of voluntary control when we are looking at motor function, we are looking at academic performance, we are looking at behavioral changes. And these types of factors, there are so many small changes we can make along the way in development that will make a whole world of difference. When we speak specifically about ADHD and autism, even sensory processing disorder, all those conditions that have this big word attached to them, it creates a lot of fear and it creates a lot of panic. But in reality, it actually gives us a really good starting point on what part of the brain we need to focus on. So during development, the brain typically develops in such a pattern. We have primitive reflexes. These are really important. I have so many babies that come in here. So my patients that are under 1 year of age, we look at where they're at developing. These types of things. So I've made charts and graphs to help other healthcare practitioners. I want them to have these on their wall. I want them to look at them. I want the parents to know about them, to know that the development is happening in such an order. We will find retained primitive reflexes in conditions associated with ADHD, autism, and sensory processing. So when we have to go back to sort of the basic foundation of how the brain is functioning and how it's communicating with the body, we really need to get a starting point and start with those primitive reflexes. And then when we talk about these things, and we look at the brain as a right hemisphere and a left hemisphere, or we can say right brain, left brain. We hear these things, but we don't know exactly what they mean. So traditionally, when we look at the right brain, we're looking at the big picture and understanding the concept of what that means. Like, what is the concept of going to school? What is the concept of taking a bath? What is the concept of eating a meal, right? Understanding sort of what that is and what that means is going to put things more into perspective. When we look at those conditions specifically, it's a right brain delay. So when we take a picture, we take MRI or a CT scan, everything is fine. Everything looks perfect, right? The anatomy is fine, but the physiology is different. And when we have a certain type of function that's inhibited, we will see sensory problems. We will see that maybe the kids are picky eaters. Maybe they don't like to wear their socks and their shoes in a certain way, or maybe they like to take their clothes off all the time. And those types of things, when the parents are looking big picture, they go, why don't they understand this type of thing, where we're saying, how about we work on that right side of the brain and we help enhance the connectivity of what's happening on the inside. And that's exactly what we do in the clinic, is we need to be very specific about what we're stimulating and why we're stimulating that. When we look at other conditions, if we look at dyslexia or dyscalculia, those are more left brain. So when we look at that left brain and how everything's integrating, our treatment is going to be very different. Again, it sort of comes back to getting that baseline and that foundation of what we need to have at a starting point. And then we set our goals. So in 3 months' time, in 6 months' time, in 1 year time, what are we looking to achieve? And we're looking at different factors. We're looking at sensory characteristics, motor function, academic performance, behavioral changes. We are also looking at the immune system and how that's functioning. So there's many different factors involved when we talk about those conditions, and opening up the conversation and actually having some type of game plan on what we're going to do in here, and then what are we doing at home? What are we doing in the schools? The LSEs that are helping support in the education process, working with them as well, helps take those goals that we have, and we just, we like to crush those goals, and then we get on to other ones after that.
That sounds fantastic. How would you describe development, early development, compared to, let's call them neurotypical children?
Yeah, so the development, we will see certain delays in development, and we will see them kind of early in life. A lot of times, for instance, I had a couple infants this week, and they hadn't been achieving the milestones, and some of them have certain conditions that they are diagnosed with. So we know that we're facing something either genetically or neurologically or vascular changes. Sometimes the unexpected happens during pregnancy or during the birth process or soon after. And those types of challenges, we know that we have a little bit of a journey in front of us to get back on track, but actually changing and modifying certain behaviors, whether it's stimulating the vestibular system the first year of life. I mean, these developmental milestones are huge. Having a baby, I had a baby this week that didn't have any spinal stability, and they were just sort of crouched forward. Within 2 weeks' time, we were able to do some vestibular therapies. I taught mom and dad how to do them, and now the baby's holding their head up. They're able to sit. Wonderful. And within a couple weeks' time, just stimulating a couple parts of the brain. We don't always know what those exercises are to do at home. We need a little bit of guidance that's specific for what we're doing.
That sounds very, very encouraging to lots of parents out there who might be needing your help. What advice would you have to parents?
So my advice that I have for parents is, let's take a look and see what's happening. I have a certain way that I look at my patients, just from not only my academic programs that I've been through, but also through the experience that I've had with kids. So I really see the potential and the areas of growth that we're able to improve. And the first step is really getting a professional opinion on what's happening. It's not one of those things that we just have to live with, but we need to know that we're doing 3 small steps on a daily basis. And those 3 small steps, whether it be how we communicate with our child, right? How do we establish boundaries? And for instance, if it's a child with ADHD, we know that what's happening when they're 5 years old, if we don't do something about it, it's going to be magnified by the time they're 15 years old. And we see these changes. We have enough research and information from across the globe on where do these things, what do they manifest into? And I don't want to panic about it, but we have to be proactive about it. We can't pretend like there is not a problem, because it's not going to go away. Like many health conditions, no matter what it is, if we just ignore it, it's eventually going to get louder and louder until we have to do something about it. In the clinic, we do promote a non-invasive approach. So by non-invasive, we say non-surgical. There's no surgery we're going to do. And it's not that we are against any type of treatment. We have a wide variety of different healthcare practitioners, because sometimes we need medication. Sometimes we need manual therapy. Sometimes we need nutritional advice. We need to know what each patient needs at a certain point in time to be able to make the changes to get to the next step. Everything, it's science, right? And when we get into it, it's not really rocket science, it's neuroscience. So when we create an environment, especially for parents, we don't want them to panic. We want them to know that this is actually truly one of the greatest gifts. We don't always want to take a child and stick them into a normal box. What we want to do is we want to pull out the potential that they have. We want to pull out those different areas of the brain that have connected in such a way that's going to be one of the greatest gifts that child has in their future. But we need to give them the skills and the tools that they need to allow them to grow up into adulthood and be independent, purposeful adults.
Wonderful. And how can parents reach out to you and book a session with their kid?
Yeah, so there's a whole bunch of different ways. I know we're opening up and sharing some of this content and information, and I want to make that readily available to people. In some cases, when they're ready, we just have them contact the clinic. So everything is online. Some patients, I actually have quite a few patients that do consultations from abroad. So when the holidays come, summer months come, we're in Malta. It's such a beautiful island in the Mediterranean. So my patients who come over from the States, it's a super great opportunity that they have a European holiday adventure in the Mediterranean, and they can also bring their kids in, and we just get them back on track. We have brain camps that are set up at certain times of the year. We have after school programs for the kids as well. And we have individualized programs for those people that are really seeking a one-to-one advice and a game plan for where they need to go.
Wow, very inspiring, very encouraging to all the parents out there. So thanks for being here with us today, Dr. Cristin, and we look forward to more.
Thank you so much. I'm happy to share all the
Great.
information I can.